You are now viewing the third of 5 segments on using the Tegaderm CHG IV securement dressing. Let's focus on how to apply the dressing. If you are using a sterile package dressing, open the package and place the dressing onto a sterile field. If you're using a kit, make sure all your components are ready for use. After skin antisepsis is complete and the skin prep and protectants have dried completely, peel the liner from the dressing, exposing the adhesive surface. Turn the dressing over so that the adhesive faces the skin. Center the CHG gel pad over the catheter site and smooth down the dressing edge. Do not stretch the dressing while applying. When a transparent film dressing is stretched onto the skin, the dressing has a tendency to move back into its normal shape. If the film adheres to the skin and pulls the epidermis with it, the epidermis may be pulled from the dermal epidermal junction or separated from the dermis, resulting in blisters. Next, slowly remove the paper frame while continuing to smooth down the outer edges of the transparent adhesive dressing. Use firm pressure to enhance the dressing's adhesion. Many medical adhesive products, including transparent film dressings, use pressure-sensitive adhesives, or PSAs, allowing the dressing to conform to the irregular surface of the skin and stick well to the contours of the body. When firm pressure is applied to the adhesive film, a greater amount of adhesive is pushed into the valleys or nooks and crannies of the skin surface, thus allowing more adhesive to be in contact with a greater amount of skin surface and providing better overall adhesion of the dressing. Continue to smooth the Tegaderm CHG dressing from the center towards the edges using firm pressure to enhance adhesion. With the heat of the body, the Tegaderm CHG gel pad conforms around the catheter, helping to increase stabilization and securement. The Tegaderm CHG dressing, number 1658, includes one notched pre-cut tape strip. Remove the pre-cut sterile tape strip from the paper frame. Use it to further secure the hub or tubing of the catheter. Tegaderm CHG dressings number 1657, 1659, and 1660 include 2 tape strips. You will want to stabilize the catheter according to your facility's protocol. Remove the pre-cut sterile tape strips from the paper frame. Use them to further secure the hub or tubing of the catheter. Other securement taping techniques may also be used, and of course, you will want to stabilize the catheter according to your facility's protocol. The Tegaderm CHG dressing also comes with a pre-cut label for you to document dressing change information according to your facility protocol. Place the label on the dressing or use the documentation label for additional securement. Be sure to secure any catheter lumens or extensions. That completes Tegaderm CHG dressing application. It's just as easy to apply as a standard Tegaderm transparent film dressing. In review, during application, remember to center the dressing over the insertion site and suture wing. Do not stretch the dressing during application. Be sure to apply firm pressure on the edges while removing the paper frame, as well as over the entire dressing from the insertion site outward. Remember, use firm pressure to enhance adhesion. Here is a short video reviewing all the steps of applying the Tegaderm CHG dressing. To apply the Tegaderm CHG dressing, open the package and remove the sterile Tegaderm CHG dressing, placing it on your sterile field. Peel the liner from the dressing. Center the CHG gel pad over the catheter site and smooth down the dressing edge. Do not stretch the dressing while applying. Slowly remove the paper frame. Use firm pressure to enhance the dressing's adhesion. When firm pressure is applied to the adhesive film, a greater amount of adhesive is pushed into the valleys or nooks and crannies of the skin surface, thus allowing more adhesive to be in contact with a greater amount of skin surface and providing better overall adhesion of the dressing. With the heat of the body, the Tegaderm CHG gel pad conforms around the catheter. Remove the pre-cut sterile tape strip from the paper frame. The 1658 dressing includes one notched tape strip. The 1657, 1659, and 1660 dressings include 2 tape strips. Use them to further secure the hub or tubing of the catheter. Document the dressing change information on the pre-cut label. Secure any catheter lumens. The dressing is now complete.